Tints and filters and how to prescribe them competently. Part 1. Options on prescribing. Introduction to tints and filters in optometry. The optical professional specializes in vision. They should be aware of tint prescribing methods, the tints themselves, the effects of the tints that can be measured, and the physical and cognitive responses that can be seen. They will be aware of the importance of discovering what visual problems are being experienced, how to get the best prescription for spectacles, and perhaps most importantly, how to interpret signs and symptoms of eye disease. They should also understand color vision and its anomalies. This is perhaps the only concession to visual stimulus problems, yet visual stimulus can cause as many problems as refractive errors. This must be addressed. For many years, tinted spectacles have served not only as a fashionable accessory but also as a critical tool for enhancing visual comfort and health. Historically, the prescription of these lenses has been hampered by insufficient training and a lack of understanding among professionals. As a result, many individuals have either missed out on the benefits of tinted lenses or received inappropriate prescriptions. When properly prescribed, tinted lenses can address a wide range of conditions, providing substantial relief and improved vision. Whether it's reducing glare, filtering out harmful UV rays, enhancing visual performance, or aiding in medical applications, these lenses can significantly improve the quality of life. In our subsequent videos, we will delve into the specific conditions that can benefit from the use of tinted lenses. While a minority of optical professionals still believe that the benefits of tinted lenses are primarily psychological, recent evidence strongly suggests that in some cases, controlling the visual input into the eyes is crucial. This underscores the importance of proper prescribing practices, which may have been lacking in the past. This study found that the greatest potential effect of tinted lenses occurs when the light is most saturated. In our later videos, we will explore the importance of this finding and its implications for optimal tint prescribing. When it comes to prescribing tints for visual aids, practitioners can use several methods to determine the most suitable tint for an individual. We will address them in turn. The most common method is empirical prescribing. This method relies on the practitioner's accumulated experience and observations, as well as feedback from previous patients with similar conditions. The practitioner uses this knowledge to recommend a tint that is likely to be effective based on their professional experience or what they have been told by colleagues or, in some cases, lens manufacturers. It is certainly an effective method for prescribing protective filters such as used in glasses to shield against UV, infrared, and X-ray radiation. However, there are real risks using this method. Empirical prescribing relies heavily on the practitioner's experience and observations, which can be subjective. This may lead to inconsistencies in the prescribed tints, as different practitioners might have varying levels of experience, knowledge, and preferences. Without standardized guidelines, empirical prescribing can result in a lack of uniformity in the tints prescribed. This can be problematic, especially when patients seek second opinions or switch practitioners. Individual responses to tints can vary widely. What works for one patient may not work for another, even if their conditions appear similar. Empirical prescribing may not always account for these individual differences. in cases where tints are prescribed to protect against harmful radiation. For example, UV, IR, and X-ray, empirical prescribing might not always ensure adequate protection. This can lead to potential eye damage if the prescribed tint does not effectively block the harmful rays. While experience is valuable, over-reliance on it can sometimes lead to overlooking newer, evidence-based practices and technologies that might offer better solutions. This can result in prescribed filters not meeting the patient's needs or expectations, and can lead to dissatisfaction and a lack of trust in the practitioner's recommendations. Another method sometimes used by optical professionals is matching overlays that have been placed over text. But, when it comes to determining the best filters for visual aids, using overlays is not just suboptimal, it is fundamentally flawed and should be strictly avoided. Overlays are double-pass filters, meaning light passes through them twice, first upon entry and again upon exit. This radically distorts the spectra as it is filtered twice. Spectacle tints, conversely, are single-pass filters, where light only passes through the tint once. This fundamental discrepancy between these two processes makes it virtually impossible to match overlays accurately with spectacle tints, even for the most seasoned experts. The discrepancies between double-pass and single-pass filters inherently leads to gross inaccuracies. Overlays are utterly incapable of providing a true representation of how spectacle tints will perform in real-world conditions. Given the substantial limitations and inaccuracies, the use of overlays for determining the best tint for spectacles is not just poor practice, it is a disservice to patients. Relying on overlays for tint selection can result in suboptimal, if not detrimental, outcomes for patients. In conclusion, the use of overlays for tint selection is unequivocally unacceptable. Optical professionals and other companies use a common method to determine the optimum tint by trial and error, usually using a forced choice technique. This involves presenting the patient with two options and asking them to choose the one they prefer. This process is repeated multiple times with different pairs of tints until the best option is identified. However, they often encounter several challenges related to tint spectra. Different tints have unique spectral properties which can affect how colors are perceived. This can lead to problems such as that two tints that look identical under one light source may appear different under another. Small variations in tint color can be noticeable to patients, leading to dissatisfaction. Tints can affect visual comfort and performance, and the optimal tint may vary depending on the individual's visual system. The spectra of two lenses may be very different, but they may appear indistinguishable during tests. However, their effects may be very different in the real world. Although methods have been known for over 100 years, standards have not been accepted by the optical professions in terms of patient and tint tolerances, annotation, and prescribing techniques. There is a need for standardized methods to measure and prescribe tints, taking into account factors like ambient lighting and individual visual needs. Trial and error require a large number of tints and tint designs. In general, this is not found, and therefore it is almost always a poor method of assessment, regardless of claims that are made. Matching tints by eye can be quite challenging due to several factors. The first is metamerism. This phenomenon occurs when two colors appear to match under one lighting condition but not under another. This happens because the colors have different spectral power distributions, meaning they reflect or emit light differently across the spectrum. The human eye has three types of cone cells that respond to different wavelengths of light, and metamerism exploits the fact that different combinations of wavelengths can produce the same response in these cones. Metamerism can be categorized into several types based on the conditions under which the color match occurs. Illuminant metamerism is when two samples appear to match under one light source but not under another. This is common with tints. For instance, a shirt may match your trousers under indoor lighting but appear different under sunlight. Observer metamerism is when two colors appear to match for one observer but not for another. This can happen due to differences in individual color perception, which might be due to age, vision health, or other factors. Geometric metamerism is when two colors appear to match under one viewing angle but not under another. This is often seen in glossy versus matte surfaces, where the angle of viewing can affect color perception. Field size metamerism is when two colors appear to match in a small field of view but not in a larger one. This happens due to the way our eyes process color in different sized areas. In addition, we may also have problems due to the dominant wavelength, which is that of refers to the specific wavelength of light that is most strongly perceived by the human eye when looking at any color. Different tints can have different dominant wavelengths, which can affect how they are perceived under various lighting conditions. The dominant wavelength is crucial in determining the hue of the color, and even slight variations can make a significant difference in how the tint appears. The von Kreis effect has to be considered. This effect describes how the human visual system adapts to changes in lighting conditions. The von Kreis coefficient law explains that the sensitivity of the cone cells in the eye adjusts based on the illuminant, helping to maintain color constancy. However, this adaptation can also lead to discrepancies when trying to match tints by eye, as the perceived color can change depending on the lighting environment. In the field of color assessment within optometry, two prominent instrument-based systems are used to tailor visual stimulation to individual needs. One employs subtractive color, the intuitive colorimeter, and the other using additive color, emulation, and the principle of univariance, the read eye. Although they would appear to be similar, they are in fact very different instruments and use different principles in practice. All optical professionals must understand these differences and their usage in clinical practice. They have very different capabilities for professionals. The simpler instrument is the intuitive colorimeter. The tint selection process using the intuitive colorimeter system is a sampling method for choosing tints supplied by Cerium. It consists of a light source with colored filters placed between the source and a target. These filters are broadband with a resultant soft-colored focus which is not specified to any recognized color space position. It has a range dependent on the illuminant and the filters which varies depending on the model. The results are not transferable to other manufacturers' lenses. It involves patients observing text illuminated with light whose hue and saturation can be varied independently without altering luminance. The examination begins under white light, and colored light is gradually introduced by increasing the saturation while keeping the hue constant. The color is then slowly returned to white, allowing patients to compare their visual comfort under colored light versus white light. 12 different hues are presented in succession, and the patient shortlists the colors that provide the most comfort. For each shortlisted hue, the saturation is adjusted to find the optimal level for maximum comfort. The optimally saturated colors are then compared, and the most comfortable one is selected. Small adjustments in hue are made around the chosen color to see if comfort can be further enhanced. If so, saturation is readjusted at the new hue. Through these incremental changes that allow for color adaptation, the optimal combination of hue and saturation is achieved, resulting in a personalized Cerium lens tint tailored to the patient's visual needs. It's important to clarify that the intuitive colorimeter is not a colorimeter in the conventional sense. Traditional colorimeters are instruments that measure the color of light sources or surfaces quantitatively, providing objective data about color properties. In contrast, the intuitive colorimeter is designed to assess an individual's subjective visual comfort when viewing text under various colored illuminations. The term intuitive highlights that the assessment relies heavily on the person's innate perceptions and intuitive responses, making the individual, not the instrument, the central component of the evaluation. Therefore, the name can be somewhat misleading, as it suggests an objective measurement tool, whereas it primarily facilitates a personal, subjective exploration of color comfort. The key aspect is the person's intuitive feedback during the assessment. This distinction is crucial because it highlights that the so-called colorimeter is, in this context, a misnomer. It doesn't perform measurements in the traditional sense but instead guides the individual through a personalized exploration of color to find the most comfortable tint. Using monochromatic light sources fundamentally revolutionizes the accuracy of color positioning within color space. This far exceeds the capabilities of systems that employ broadband filters with fluorescent tubes like the intuitive colorimeter. Monochromatic sources emit light at specific, singular wavelengths, allowing for precise control over hue and saturation without the ambiguity introduced by broader spectral outputs. This precision is crucial. It means that when assessing and prescribing tinted lenses, we can pinpoint the exact color that provides maximum visual comfort for an individual. By harnessing monochromatic light, we can determine a tolerance gamut, the specific range of colors a person can comfortably perceive. The red-eye device exploits this advantage fully. It doesn't just replicate one lighting condition. It emulates any lighting or combination of lighting, and can reproduce any tint from any manufacturer. Critically, it can replicate any optometric tint design, which is vital for achieving the optimum responses in patients. This versatility is a game changer. It effectively eliminates metamerism as an issue. Metamerism, the phenomenon where colors match under one light source but not another due to spectral differences, is eradicated. The tints prescribed will perform consistently across all lighting conditions, ensuring reliable visual comfort wherever the wearer goes. Moreover, the red-eye's color gamut is nearly double that of the intuitive colorimeter, edging close to the ideal gamut necessary for precise color assessment. This expanded gamut isn't just a technical detail, it's a significant advancement that allows for much more saturated tints. Higher saturation levels mean that the tints can more effectively target and attenuate the specific wavelengths that cause visual problems. The result? Tints that are not just marginally better, but significantly more effective in alleviating symptoms. In stark contrast, systems using broadband filters over fluorescent tubes lack this level of precision and versatility. Their broader spectral output leads to less accurate color representation, making it challenging, if not impossible, to identify the exact tint that offers optimal comfort. Furthermore, the inability to control for metamerism means that the effectiveness of the tint can be inconsistent across different lighting environments, undermining the confidence in the prescribed solution. By utilizing monochromatic light sources, devices like the red-eye achieve unparalleled accuracy and customization in tint selection. This isn't just a minor improvement, it's a significant leap forward in optometric technology. It enables the creation of highly personalized lens tints that can dramatically enhance visual responses and reduce symptoms associated with stimulus difficulties. The impact on an individual's quality of life can be profound. Understanding and embracing these technological advancements is crucial, not only for optometrists striving to provide the best care, but also for the broader exploration of how light and color affect human perception. This precision in color control has far-reaching implications beyond optometry. Influencing fields like medicine, where accurate color reproduction is paramount, and lighting design, where the quality of light can affect mood and productivity. All professionals should be aware of the weaknesses as well as potential advantages of current management techniques. Empirical assessment and prescribing techniques are riddled with significant shortcomings, despite their importance in providing protective filters. Empirical methods, which, in this context, means professionals basing decisions on data supplied by others without proper validation, creates a dangerous dependency on potentially flawed or incomplete information, leading to misguided conclusions and actions. It is common in optical practice as much information given to professionals is anecdotal. Professionals must remain acutely aware of these limitations and approach empirical data with a critical eye. Blindly following such methods can compromise the integrity and quality of their practice. Recognizing the inherent weaknesses of these techniques is crucial. Professionals should exercise extreme caution when considering trial and error methods for assessment and prescribing. While these methods might offer short-term insights or quick fixes, they come with serious drawbacks. Trial and error can lead to inconsistent results, wasted resources, and potentially harmful outcomes. This approach lacks the structured, data-driven foundation necessary for reliable and replicable results. Additionally, relying on trial and error undermines the credibility and integrity of professional practice. It suggests a lack of preparedness and understanding, which can damage trust and confidence among clients, colleagues, and stakeholders. The absence of a systematic approach also means that lessons learned from errors are not effectively captured or utilized, leading to repeated mistakes and inefficiencies. Professionals must avoid these pitfalls by adopting more rigorous, evidence-based methods. This ensures that decisions are well-informed, consistent, and reliable, upholding the highest standards of professional integrity. Abandoning trial and error methods in favor of validated, systematic approaches is essential for achieving optimal outcomes and maintaining credibility in professional practice. In using color wheel methods such as the intuitive colorimeter and subtractive color, there are many practical limitations. Assessing these, it becomes clear that its use is riddled with serious drawbacks. One of the most glaring issues is the limited range of colors it can produce, determined strictly by the original lighting and filters. This restricts the palette, leading to inadequate sampling that fails to capture the full spectrum of colors necessary for comprehensive analysis. Additionally, the reliance on broad-spectrum design tinted lenses further diminishes its effectiveness. Broad-spectrum lenses are unable to achieve sufficient coverage, resulting in significant gaps in the color range. The restrictive nature of using only the manufacturer's own lenses exacerbates these limitations, preventing flexibility and adaptation to various lighting conditions or specific requirements. Furthermore, metamerism and color mixing problems add to the complexity, making the subtractive color wheel an unreliable tool for precise color determination and application. These critical flaws highlight the need for more advanced and adaptable methods in professional practice. Blind reliance on such a limited system can lead to suboptimal outcomes, undermining the integrity and effectiveness of the assessment process. In conclusion, assessment and prescribing techniques that rely on empirical data and trial and error methods are fundamentally flawed. These methods depend heavily on unverified data, resulting in misguided decisions and a one-size-fits-all approach that fails to address unique cases. They are also resource-intensive and inefficient, often leading to delays and compromised outcomes. Professionals must adopt more rigorous, evidence-based methods, like additive methods, to ensure reliable and replicable results. Additive methods, despite requiring more technical knowledge and complex instrumentation, offer a superior alternative. They provide a comprehensive approach to color assessment, addressing the limitations of subtractive methods and broad-spectrum lenses. Additive methods ensure a wider range of colors and more precise coverage, making them the preferred choice for professionals. Additionally, it is crucial to acknowledge that other methods have historically been instrumental in being the cause of criticisms in tint prescribing. These justified criticisms have highlighted the limitations and inefficiencies of traditional approaches, underscoring the need for more advanced techniques. Embracing additive methods enhances the accuracy and effectiveness of professional practice, ensuring the highest standards of integrity and optimal outcomes. Professionals should be critical of empirical and trial-and-error techniques and prioritize additive methods to achieve the best results while addressing past criticisms of tint prescribing. Don't forget to subscribe. There are a lot of videos to come suitable for both professionals and parents. Make sure you don't miss them.